Pakistan, land of the pure, a land of diverse culture and traditions. Pakistan's geographic location next to Afghanistan, the world's largest producer of illicit opium, places the country in a vulnerable position in terms of drug trafficking as well as drug abuse. According to UNODC, the world uses over 5,000 tons of opium every year, while Afghanistan produces 90% of this global opium need, 40% of which is transited through Pakistan. Opium is not the only illicit trade on the Pak-Afghan border regions. Afghanistan is also the largest cannabis-producing country of the world. Apart from this, chemicals known as precursors destined for Afghanistan from other countries are also a big threat. These chemicals are transported to Afghanistan mostly through Pakistan's seaport using mislabeled consignments.
We are not just victims of drug abuse. In Pakistan, our problem is much more complex. We are a transit country for drugs emanating from Afghanistan. Therefore, we in Pakistan face the biggest challenge in the world.
The counter-narcotics efforts of the government of Pakistan are led by the Anti-Narcotics Force popularly known as ANF. The first anti-drug setup in the country, Pakistan Narcotics Board, was established in 1957. Later, in 1973, it evolved into Pakistan Narcotics Control Board. An anti-narcotics task force was established as a parallel entity in 1991, and finally in 1995, both were merged to create ANF.
टारगेट आ रहा है
At present, ANF's strength is about 2,482 personnel. ANF reports to the Ministry of Narcotics Control. Ministry of Defense takes care of the Maritime Security Agency MSA and Airport Security Force ASF. Civil Armed Forces is under the Ministry of Interior. ANF has the lead role in this configuration. Recently, an interagency task force, IATF, has been developed with ANF in the lead and 29 law enforcement agencies as members. IATF's primary task is to coordinate drug interdiction strategies and enhance cooperation amongst law enforcement agencies. With a nationwide presence, ANF is responsible to collect intelligence, make arrests, seize drugs and drugs-generated assets, and investigate and prosecute offenders. With limited strength and resources, ANF performs its functions with zeal, devotion, and relentless efforts round the clock, focusing at the 2,500-kilometer-long western border, all points of entry and exits, and 25 ANF police stations spread in various parts of the country. ANF pursues a threefold strategy. First is supply reduction. This focuses on prevention of drug trafficking, poppy eradication, precursor control regime, prosecution, assets investigation, management, training, and capacity building. Second is drug demand reduction, including awareness, community participation, treatment and rehabilitation, and harm reduction. Third is international cooperation. Last but not the least includes demonstration of political will in anti-narcotics efforts, exhibition of commitment towards international obligations as common and shared responsibility, facilitation and exchange of information, and joint operations to dismantle international drug trafficking networks, pursuance of existing MOUs, and enhancement of areas of cooperation and active engagement within the international community at various forums while safeguarding national interest.
The contribution made by the ANF in the war against the drug will be long remembered, and the sacrifice of soldiers or officers of ANF will never be forgotten.
The new National Anti-Narcotics Policy 2010 aims to re-energize the existing national drug law enforcement institutions, build the anti-narcotics force capacity, develop an effective coordination and control mechanism, and mobilize the people of Pakistan, especially youth and institutions at national and international level of both private and public sector, to ensure their active participation in eradicating drugs. This policy also seeks to promote international cooperation for mutual support and partnership against narcotics drugs.
Of course, the phenomena of drug trafficking is a worldwide menace, and we're here to play our part in that regard. We have had a number of successful investigations of transnational crime syndicates operating between Afghanistan, Pakistan, and Australia.
The problematic areas in terms of poppy cultivation are largely concentrated in the federally administered tribal areas, FATA. While the area cultivated in Pakistan during 2007 was equivalent to only around 1.2% of the area cultivated in Afghanistan. One of the most common conduits for trafficking heroin is the aerial route. To impose strict check on this mode of trafficking, ANF focuses on all international airports and flights. Approximately 13,000 passengers and 70 flights are departing daily from different airports of the country for about 50 destinations. In the year 2010, ANF conducted several successful operations and arrested 297 persons, including 86 foreigners. ANF also monitors the Hajj operations every year with the Civil Aviation Authority to control the smuggling of narcotics to Saudi Arabia. Another sensitive point of entry and exit is the dry port. Special attention is paid to check all the consignments through various methods. A more recent trend in drug trafficking is the use of the various private national and international courier services. ANF, in collaboration with these enterprises, keeps a tight check on the transactions, especially destined for and from Afghanistan. High point of the terrain is the 1,600 kilometers long India-Pakistan border with well-fenced boundary and proper points of exits and entry. Pakistan shares 909 kilometers border with Iran. Openness of terrain on both sides of the border and its proximity to Pak-Afghan border makes it a favorite with drug smugglers. The length of border with Afghanistan comes around to 2,538 kilometers, out of which 1,300 kilometers is opposite Khyber Pakhtunkhwa and remaining with Balochistan. The border with Khyber Pakhtunkhwa is porous with multiple routes which are difficult to ward, whereas border with Balochistan is rather open, which is suitable for large vehicle traffic. The drug traffickers are exploiting the nature of the terrain. Volume of vehicles passing on a daily basis through the Torkham Pass and the Pak-Afghan border is 800 to 1,000 vehicles in one day. Chaman border in Balochistan with a little less but hard to manage number of 250 to 300 vehicles passing per day.
देख रहे हैं कितना रश है, कितनी गाड़ियां आ जा रही हैं, तो इसमें हम इन को भी चेक करते हैं, आउट को भी चेक करते हैं। तो इसमें हमारे लिए मसले मसाइल इस तरह हैं कि एक तो एक्सरे मशीन नहीं है कि कोई गाड़ी को हम मैनुअल तो हम चेक करते हैं, अपनी पूरी जान मारते हैं। हमारे पास कोई मशीन नहीं है, लेटेस्ट इस तरह मशीनें हैं बाकी मुल्कों में कि वो हमें अगर वो प्रोवाइड कर सकें तो इससे हमें आसानी होगी।
Coastal belt is 1,062 kilometers long and is inadequately covered by the law enforcement. Passing through seaport per day is over 1,200 to 1,300. Despite the pressure and magnanimity of the task, ANF has commendable achievements despite its limited resources. And in spite of limited resources, ANF has achieved major breakthroughs in combating the menace of drugs at national and international levels. Pakistan has consistently been in the top 3 slots in the world for seizures of opium, heroin, morphine, and hashish since 2003. In 2010, only ANF and other LEAs seized over 20,109 kilograms of opium, about 4,355 kilograms of morphine, 5,234 kilograms of heroin, 228 kilograms of cocaine, and 186,875 kilograms of hashish. As part of its pledge to work towards a drug-free Pakistan, ANF holds official drug-burning ceremonies regularly each year. However, during 2010, only 87,784 kilograms of narcotics and other harmful substances were burned. The main trends of drug smuggling today in Pakistan include bartering of heroin with cocaine, smuggling of cocaine into Pakistan through ingested capsules, increase in drug trafficking towards the Far East, drug trafficking through East Africa instead of West Africa, increased drug trafficking through Gulf region, heroin transportation being surpassed by opium and morphine, increase in heroin prices, use of networks or groups or families for trafficking, smuggling of buprenorphine injections from India to Iran via Pakistan, manufacture of acetic anhydride in Afghanistan, use of foreign and local carriers, small and well-protected convoys through Balochistan, more usage of the aerial route due to increase in traffic, use of transit countries to hide points of origin and final destination, use of vehicles with fake government number plates, human smuggling coupled with drug smuggling. ANF has effectively managed to keep a track of the changing scene of drug trafficking in Pakistan. To ensure speedy disposal of narcotics cases, 6 special courts, CNS, are functioning exclusively for the trial of counter-narcotics cases. Conviction rate stands between 88 to 91%. Pakistan is one of the countries hardest hit by narcotics abuse in the world. According to national drug abuse surveys, the number of chronic abusers of heroin increased from about 20,000 in 1980 to more than 1.5 million in the late 1990s. Currently, the estimated number is around 5 million. In the last 50 years, Pakistan has seen a change in drug usage patterns at least thrice. Abuse survey conducted so far indicates that number of drug users is increasing at the annual rate of 7% in Pakistan. Out of the estimated 5 million drug users in Pakistan, around 0.628 million are opium users. 0.124 million of these are IDUs, contributing to the spread of HCV, HIV, and AIDS. Majority of drug users are in the age bracket of 15 to 34. From low income, it spreads to middle to high income groups, especially among the youth. The most recent change occurred with the entry of amphetamine-type stimulants like ecstasy and cocaine, especially in the youth of higher socioeconomic strata. The drug abuse problem is multifaceted and affects every aspect of society. ANF has therefore attempted to develop a comprehensive plan of prevention engaging significant segments of society like the media, religious and voluntary organizations, schools, healthcare providers, and law enforcement agencies. Major activities include conducting research and surveys, maintaining a liaison with NGOs and CBOs nationally and internationally. ANF's drug demand reduction strategy revolves around awareness, community participation, treatment and rehabilitation, and harm reduction. Prevention, as part of drug demand reduction, attempts to prevent the occurrence of a drug problem. 2 projects are currently in process. Community participation in drug demand reduction, including lectures, workshops, cycle races, debates, declamation contests, and sports. Creating mass awareness using media and entertainment programs like drama serials, talk shows, telefilms, and musical programs. Prevention also aims at treatment, rehabilitation, and social integration plus harm reduction. Model addiction treatment and rehabilitation centers, MATRCs, have been established. One in Islamabad, another in Quetta, and third in Karachi. ANF has acquired a hospital building in Karachi from the city district government. Provision of free of cost treatment as per international protocol with a 15 days detoxification and a 30-day rehabilitation exercise are ANF's main demand reduction tasks. Till February 2011, 5,714 patients have been treated in these absolutely free of cost facilities. 2 drop-in centers for injecting drug users have also been established at Rawalpindi and Quetta, where drug addicts are provided with necessary first aid to protect themselves from harmful effects of addiction. At the same time, counseling and guidance is provided to them and their families to control the epidemic of HIV/AIDS and other blood-borne diseases. A pilot project for treatment for drug addicts in Adiala jail was launched by ANF in March 2010. Despite limited resources, a 10-bed detoxification ward has been established. A team comprising of a psychiatrist, a medical officer, a psychologist, and motivator from MATRC Islamabad visits the facility regularly. A large number of patients have been detoxicated and reverted to normal life. Plan to establish a complete treatment and rehabilitation center equipped with all the facilities and staff is underway, for which national and international help is required. Every year, June 26th is celebrated as World Anti-Drug Day. Messages and activities are conducted nationwide to remind the public at large about this menace. Nothing is possible without the help of our global friends. ANF pursues a very active international cooperation strategy. MOU and treaties have been signed with 28 world countries. ANF is actively involved with UNODC, INCB, Interpol, NAS, FANC, and DLOs. Operation Octane 2010 is one achievement ANF feels proud of. It was a joint operation by DEA and SIC. This one-team concept resulted in the seizure of the world's largest quantity of acetic anhydride and hash. It is also known as the world's largest haul of narcotics or precursors that lasted 4 days. Operation was carried out in Karachi, Dubai, China, and Canada. Nothing is possible if the execution lacks perseverance. The crux of the matter is that whatever ANF has achieved is solely due to the hard work, dedication, and resilience of its force. The ANF officer on the street knows that he is not just fighting crime, he is saving lives of people who include his very own loved ones. This makes this force unique and the process of selection and recruitment special. Capacity building of ANF personnel is also a prime concern. The process of recruitment and training of ANF staff has recently been redefined and further strengthened. It takes courage to join any force, but it takes sheer determination to join the anti-narcotics force. The process of recruitment is well defined and transparent. The profile of candidates is clearly identified to select the right people for all posts. Trainees who successfully complete their training have a passing out parade to formally announce the start of their official responsibilities at ANF. The current training module is of 6 months. This enables the recruits to handle all possible situations on ground level and also help them to create solutions on the spot for any given unexpected situation.
Anti-narcotic force as it exists today was formed in 1995, but Pakistan Narcotics Control Board has existed since 1957, which shows that Government of Pakistan since then is working seriously towards this responsibility of hers to check the drugs in Pakistan and also fulfill her international obligations. We have made a new anti-narcotic policy in 2010. We have made a master plan for the next 5 years, which will extend till 2014. Interagency task force has been created with the purpose of harmonizing all the existing law enforcement agencies, and an initiative to solicit the support of the people at large has been taken by Prime Minister himself, which is the drug-free city of Lahore. The work has already started rolling on that also. And the first thing which has been significantly done there is that a gang of 34 Nigerians which was there has been busted. Second point that I want to make is that anti-narcotic force is about 2,500 plus. Certainly it's not designed to go on the streets and cities and check this menace there. It is for the other law enforcement agencies to do. Our task is strategic interdiction. And in that area, I would strongly say that the force has done appreciably well. Despite all I've said about the achievements of ANF, you all know that the society is increasingly getting proliferated with drugs, not only in Pakistan, but the world over. So what is to be done? We have all to join hands against this menace. It's not for a force or agency to do it alone. We have to work together. It's like global warming. It's coming. If we don't join hands together today, it's going to destroy our generations to come.